untreated heartburn or acid reflux can lead to cancer, which is pretty crazy. If you want a way to force your body to permanently stop acid reflux and heartburn in 48 hours, click the link in the description below. For now, let's get to today's question.
The question: have doctors used Ppis drugs? Have they felt their side effects when they stop working? Answer by Ray Schilling. I have taken cimetidine, Tagamet, ranitidine, Zantac, and finally Proton-Pump inhibitors, namely omeprazole, Losec. I did get some side effects as listed here. Losec, uses, side effects, interactions, med. Broadcast. I came to the conclusion that I was only treating my stomach acid problem symptomatically, no matter how sophisticated or strong the pills were. I did not like the dry mouth, which was one of the side effects I experienced, but most of all, I did not like that the PPI, which was the strongest pill among the three, started to wear off. I simply did not get the relief I expect from such an expensive medication. Then I came across a useful book by Dr. Michael Murray, A Naturopath, Ref. 1. When patients have H. pylori, an infection in the stomach, which makes stomach acid problems more chronic, the doctor may recommend triple antibiotics. I did not progress to this stage. A well-researched remedy for stomach ulcers is licorice root. Licorice, however, contains glycyrrhetinic acid, which can elevate blood pressure. So scientists developed deglycyrrhizated licorice tablets, DGL for short, which is very effective in relieving stomach ulcers, but has no side effect of elevating blood pressure. It comes in chewable tablets, 380 to 400 milligrams of DGL per tablet. According to Murray, Ref. 1, the growth of H. pylori, the bacterium that causes difficult to heal ulcers, is inhibited by DGL. In head-to-head studies, which are cited in Ref. 1, DGL was more effective than Zantac, C, Tagamet or antacids. 2 to 3 chewable DGL tablets taken between meals or 20 minutes before meals will heal ulcers within 8 to 16 weeks. The difference is that with DGL the ulcer is healed, while with standard medication described above it is only symptomatically suppressed, but will often flare up when the treatment is stopped. DGL stimulates the normal defense mechanisms of the stomach and duodenum, improves the protective substances that line the intestinal wall, and improves blood supply to the intestinal lining. The result is that the lifespan of the intestinal cell is prolonged. After having read this, I went to the health food store and tried exactly what I described under point 2. Within 3 or 4 days the acid problem was gone. I had seen a gastroenterologist in the past who did a gastroscopy. Nothing abnormal was found. He said I should go back to Zantac and take that for the rest of my life. A few years later, when I saw him again for a routine colonoscopy, my mother had died of colon cancer and I had several colonic polyps removed. He asked me how my stomach was. I told him that I had stopped the Zantac, because it interfered with my sex life. Zantac, OTC, uses, side effects, interactions, med. Broadcast. I did not tell him about DGL that I kept on taking intermittently. At that point he said, I don't think you need to take anything regularly. Just take a few antacids when your stomach burns. Which should do it. I thought that this was good advice. So, when an antacid pill does not quite do it, I am adding 2 DGL tablets. This has served me well for several years. I don't have any appetite for side effects from Losec and Zantac. Ref. 1, Michael T. Murray, N.D. What the drug companies won't tell you and your doctor doesn't know: the alternative treatments that may change your life and the prescriptions that could harm you. Area Books, subsidiary of Simon & Schuster Incorporated, 2009, page 73.